legitimate question. Does surgical ablation improve mortality? And yes, it does. And so here's that data. And a lot of this data is just coming out. And Dr. George put this slide together, which is fantastic. This is McCarthy's study that was just released in 2020. So this is looking at midterm survival in patients treated for AFib, propensity match comparison with patients who do not have AFib. And so this is kind of what we were getting at earlier. And so here's survival probability on the y-axis. This is follow-up at 5 years. And in the red line down here, you see untreated AFib. And in the blue line and the green line here, you see patients who had no AFib in the green line, and then the AFib that was treated in the blue line. And again, what you see is that you've restored that kind of normal clinical pathway for these patients. Their survivability has gone back to essentially what it would have been if they had no AFib to begin with. So great study by Dr. McCarthy and his group that just came out. If you look at some of the other studies, again, this is another study by Dr. McCarthy and Dr. Malazri out of Northwestern, where they're looking at just paroxysmal AFib. Again, treated paroxysmal patients do better over a long-term 5 years compared to patients who did not have their AFib treated. So again, sometimes we, kind of don't take paroxysmal AFib seriously, but we definitely should be. You can really help these patients. You can improve their survival probability over time. This is a patient or a study, I should say, from Damiano's group out of WashU. Again, comparing treated AFib with the Cox-4 to untreated. Excellent study up to 10 years now. So this is some long-term data looking at overall survival with treated AFib. And you can see folks who've had their AFib treated with the Cox-4 do significantly better than those that don't. And then this other study, this was the Chamberlain paper that was presented just a couple of years ago at the AATS meeting by Dr. Arabarn from the Northern New England Consortium. And this was just kind of an excellent study because it was a representation of what's happening in the real world. And so what he highlighted in his consortium up in Northern New England was if you were to compare patients who, based on proportion surviving, patients who had no surgical ablation versus surgical ablation, how did those folks do? And you follow them out to 5 years. What you found is in this patient population in Northern New England, this is patients, all comers, cabbage valves, isolated valves. You lump them all together and then you sort out patients who had some sort of surgical ablation versus no surgical ablation at all. Folks who had a surgical ablation did significantly better than folks who did not. And what was really interesting about this study too is if you look at the data, I think only about 22% of patients in their entire patient cohort were actually treated. So even though only a small portion of patients were treated, significant improvement in the proportion surviving with any sort of surgical ablation. This didn't even talk about, Cox-4 versus a left versus a right. This was just any surgical ablation, all comers. If you do some sort of ablation, these folks do better. So kind of real world example of what's going on with AFib treatment. Unlike the other stuff we see, right? When you treat AS, patients get better right away. But yeah, just like, as somebody who's an expert in transcatheter treatment, I'm sure you see changes in the ventricle over time with AS, right? Kind of the same thing with AFib. We're looking at things that take time to happen. The ventricle changes over time. Like you said, their medications change over time. And, what's kind of cool if you're passionate about AFib and following these patients out years and years down the road, it's kind of fun when you treat them and they're getting better the longer you're following them. It's not something we always see in cardiac surgery. Someone comes in at 72, you treat their AFib, and they feel better at 75 than they did at 72. It's a pretty cool process to be part of.